What should we assume about Brexit and its consequences for key public services? It's clear that the effects of Brexit will be asymmetric in their consequences for services such as policing, health and local government. As I've discussed in previous recordings, some areas are far more affected by the potential break with the EU institutional and legal complex, while for others it's the employment of EU 27 citizens after Brexit that represents the main challenge. The economic conditions that lie ahead are of course of major significance, but in attempting to work out where the vulnerabilities lie, there are a number of what I will call Brexit-induced political states which need to be considered as impediments to much-needed public service reform. The NHS, police services and social services controlled by local government probably anticipated the ending of austerity around about 2018. While the precise economic consequences of Brexit and the implications for taxation and public spending will be the subject of difficult exercises in modelling and estimation, it is clear that a degree of uncertainty over resourcing needs to be factored into the future management of key public services. This creates a political state where behaviours developed during austerity may be prolonged longer than would have been the case had Brexit not been happening. We should consider whether during austerity public service leaders tended to find innovative responses to resourcing and delivering services, or were instead seen to rely rather more on short-term coping measures. Classic path-dependent behaviours imply organisations concentrate on what they know best and what they know works. If Brexit further encourages a path-dependent mentality, then strategic departures from current practices, such as those set out in Policing Vision 2025 or the NHS England Forward Review, are likely to be avoided. The second political state, which concerns me, relates to the lack of a public discussion over the implications of Brexit for public services. New strategic directions for policing, healthcare and local government services need at some point to be legitimised in a discourse that takes place in established political institutions which command public attention. Instead, argumentation to date has been dominated by what frequently resembles a rerun of cases made during the referendum. Things have not been helped by the reluctance or perhaps lack of capacity on the part of central government departments to represent, quantify and estimate Brexit consequences. This may be explained by an excessive fear around providing access to data, which may cause public anxiety and perhaps compromise negotiating positions with the EU bloc. Alternately, the poor level of data being supplied may be explained by a traditional resistance to transparency which characterises some parts of the British state. At some point, there does need to be a public debate over Brexit and public service reform based on plausible premises. This needs to move beyond Whitehall and involve public service leaders. My Type 3 political state also relates to the compromising of the circumstances in which public service changes need to be developed and implemented. The problem here is the length of time negotiations will continue to dominate politics in the United Kingdom. Brexit endpoints are not emerging in a timely manner as far as public services are concerned. Unlike the private sector, public services have no relocate option, nor can they redefine their target client markets. A lengthy period of indeterminacy on the extent of the changes involved in reconstructing relationships previously based on the EU institutional complex which covered areas such as reciprocal patient care with EU 27 member states, or the sharing of data used by police services, increases the likelihood that public services will be dominated by last-minute expediency and stopgap solutions, which will further frustrate reform agendas. Overcoming these unintended, perhaps unanticipated Brexit consequences is going to be difficult in the absence of stable, long-term political leadership.